All right, good afternoon, everyone. I'm Nia Sutton, Program Manager for Emergency Preparedness and Response at AMCHP on the Workforce Development and Capacity Building team. And I'll be moderating this session, this Q&A session for us today, along with my coworker, Michaela, who I will allow to introduce herself.
Thank you so much, Nia. Hello, everyone. My name is Michaela Fry. I'm a program analyst on the Equity, Epidemiology, and Evaluation team here at AMCHP. It's so good to see everyone here.
Great, so I'll pass it over to our presenters so that you all can introduce yourselves to those in the room.
Great, I'll get started. Thank you, Nia. My name is Maria Rivera, and I'm a health communication specialist here at the Centers for Disease Control and Prevention. I'm with the Division of Reproductive Health, and I sit in the Emergency Preparedness and Response team. And I've been supporting the COVID-19 response on the Pregnancy and Infant-Linked Outcomes team, along with my colleagues Neha and Kara, who I'll let introduce themselves as well.
I can go next. I'm Neha. I am also a health communication specialist, a contractor for the Division of Birth Defects and Infant Disorders, and have also been supporting the Pregnancy and Infant-Linked Outcomes team.
Hi, everyone. I'll round it out. I'm Kara Pullen. I'm the team lead for the Health Communications and Research Translation team in the Division of Birth Defects and Infant Disorders. I've been working really closely with Maria and Neha on communications for COVID-19 and pregnancy and COVID-19 vaccination during pregnancy during the response this year, last couple of years.
Awesome, thank you all so much. So I'm gonna go ahead and pass it right back to you all. Our presenters want to start this session with some questions that they have for this group, and then we'll move to the questions that you all have for our presenters.
Thanks, Nia. So I wanted to just start just to see how familiar everyone is with the resources that were just presented to you all. So I'm going to ask you a question in the chat, and if you could just answer directly in the chat with a yes or no, I think it'll give us all just an understanding of where everyone is in terms of their familiarity with the online resources and the other resources that we presented. So have you ever seen, or did you know about these CDC resources before today's workshop? All right, great. Awesome. Okay, great. Glad to see that some people found this to be new information. That's great context. All right. And for those of you that have seen these materials before today's workshop, okay, great. Some people have seen the tracker. Would you let us know if you've actually used these resources in your work, in your organizations, or in your jurisdictions? And if so, maybe which ones? Okay. See, some people had referred to the data tracker. That's helpful. Great. Thank you. That's great to know, Rach. Okay, great. This is really great feedback for us, knowing that the products that we're working on, you've all found helpful or have used in some of your work. Great. Thank you all so much. Thank you for sharing that. And if there's time later, maybe we can discuss maybe some of the concrete ways you all have used these. But I think this gives us a good idea of the familiarity of everyone with the resources before we get into our discussion questions. Thanks.
I can go ahead and address the question that was submitted in the AMCHP presentation portal. It was, let's see, it was, what is the process of moving toward the use of more inclusive language around pregnancy look like at CDC, i.e. pregnant people rather than pregnant women? Do you have any resources around language to share? And I can start the response for that one, and then I can see if any of my colleagues have anything to add. But like I mentioned at the beginning of the presentation, within the COVID response, we kind of settled on using the term pregnant people when we were providing recommendations to the public and to providers that work with the public. But when we were referring to specific data sets or analyses, we used women if that was what was used in the analysis, because the data at times was based on self-reported female sex. But we are continually working on making sure we're being thoughtful about inclusive language, including language specific to pregnancy. But CDC does have a guide for inclusive language that is publicly available that we can paste a link to in the chat. Or Maria already did, and Kara did. Yeah, so I don't know if there's anything else that anyone else wants to add.
I'll just chime in a little bit here. I think moving forward, it's been a challenge here at CDC. There's so many different groups across the agency working on this topic, but CDC is committed to health equity. And so it is something that we continue to strive toward. There's lots of conversations happening within the agency. Our group in the Division of Birth Defects and Infant Disorders obviously works on topics related to pregnancy, Maria's group in DRH, but also we had a conversation this morning about this topic with our colleagues who work on reproductive related cancers. So there's just a lot of energy around the agency about what is the best terminology to use and how to be inclusive. So I will say it's a work in progress, and it's something that we are continuing to strive to better do and make sure our language is inclusive and as specific as we can be at the same time.
Yeah, thanks, Kara and Neha. And I will just add that, this CDC's Health Equity Guiding Principles document, in lieu of these ongoing conversations and the direction that everything is moving, it's not prescriptive. And so it's really is based upon the knowledge and the understanding of what is the most appropriate message for the audience that you're trying to reach. And so I would keep that in mind when applying these health equity guiding principles, and knowing that the most important thing is really knowing your audience and what their needs are always in this ongoing conversation, and how these recommendations continue to evolve. And yes, I would say that is probably the most comprehensive guide that the agency has right now. So any language adoption or changes would be incorporated there.
Awesome. Thank you all thank you for that question, and also thank you all for that response. That's something that AMCHP is working on as well, as far as inclusive language and making sure that we are being equitable and inclusive in our language. And then I'm also a sex educator by training. And so what I'll just add is that language is always changing. And so it's best to, just like Maria just said, to engage with the language that you know, and that that your audience will understand. All right. Thank you all for that. The next question that we have is a clarifying question. Did you say that state agencies and local public health will need to translate the materials in non-English languages? If yes, does CDC offer small grants to help with translation?
Start a response to that question. Thank you for the question. So really what we've already had the print materials specifically translated into different languages. They're all available in Spanish, and as jurisdictions throughout the response have contacted us to be able to translate into other languages that might serve their local populations, we have been able to do that in the past 2 years, especially when there were a lot of resources devoted to the COVID-19 response. All of our online materials are available in simplified Chinese, Korean, Vietnamese, and Spanish, as well as English. And those can also be printed if some of those consumer-facing pages are materials that you need to use in your local jurisdiction. But no, I think translation is always a challenge, and finding quality translations and the time and the money to be able to do that in an evolving emergency situation is difficult. But know that we try to be as responsive to the needs that are reported to us in terms of being able to translate that. And as long as the resources are there for the COVID-19 response, we do try to make an effort to translate into languages that are requested by jurisdictions, knowing that they may need that to reach local populations that we're trying to serve as well. So I hope that clarifies.
Awesome. All right. Are there any more questions from any of our audience members for our presenters? We don't have any more in the platform, but if you all have questions that you would like to ask, feel free to raise your hand, drop them in the chat, or come off of mute after. Yes, or just come off of mute. And I see we have a hand raised, so I will go ahead and turn it over to you.
Hi, everyone. Thank you so much for the presentation. It's very much appreciated. I am the maternal and child health epidemiologist in New Mexico. And I was actually also a pregnant person kind of during the initial vaccine rollout, and I was able to get vaccinated in spring of 2021 before the official strong recommendation. So I really appreciate kind of all the work that your team has done throughout the pandemic, and I used it, to inform my own decision as well as to inform the efforts in our state, which I have been deeply involved in. And so I just wanted to ask a quick question on the focus groups, which I thought were really, really interesting because we're seeing some interesting qualitative responses, when we're asking about motivation or hesitancy to get a vaccination. And so it sounded like, and please correct me if I'm wrong, it sounded like folks who are already vaccinated were included, and then folks who are hesitant but kind of thinking about getting a vaccine were included. Was there any effort made to enroll folks who had no intention of getting vaccinated?
Yeah, so this, thank you for the question. I will say when we were first considering this project, it was early on, and this was pre-rollout. So we were really trying to get information early on, and that we were focused on the people we thought we really needed to convince. So that was the decision at that time. We have since started another project that we've been working on. Sorry, my light in my office just went out. So we've started another project, and we are talking to unvaccinated, so people who are still unvaccinated. This was probably a couple months ago was our last conversation with them, and we are hearing a lot of the themes from those conversations are around the newness of the vaccine and still not trusting it. There's still a lot of misperception around prevention versus protection. So observing the vaccine to be well, if I'm still going to get COVID, what's the point? I think the variants that came about from Delta and Omicron and how people are still getting less effectiveness of prevention from the vaccine as compared to, that first summer, I think has really been challenging to communicate. A lot of the people that we talked to as well who are still hesitant were similar to what we heard initially, just fine, riding it out, waiting until pregnancy was over and just really concerned about putting anything, that they didn't want, and, no new things. And I was pregnant at the beginning of the response. So I had my baby in March 2020. So it was right in the weird, we weren't sure how we were going to deliver babies and if I'd have my husband with me and all that stuff. So I remember that, but luckily I got my vaccine while I was nursing, and I was very grateful for all the information that was coming out of CDC because I was using all of it as well. So I don't know if that helps answer your question, but I would love to connect with you and hear about what you guys are doing in New Mexico as well, because this is something we're continuing to work on.
Yeah, thank you so much for that response. And I just want to give you all big snaps and kudos too for the inclusive language. We did adopt it last year, and it is such a challenge to include on our social media at times. So I appreciate it, and we appreciate the new resource too, because I know I had seen a previous iteration of that inclusivity communications guide. And so I love the new page as well, and I'll be sure to share that also.
Great. Thank you.
And if you want more information on those focus groups, not the more recent conversations that Kara referenced, but the focus groups that were in her presentation, there's a poster in this conference on those focus groups if you want more details.
Any more questions for our presenters? Or any reflections or thoughts that you would like to share with the group? Feel free to come off of mute or drop them in the chat box. All right, Rosemary, you can unmute and share your question.
Thank you, Mia, and really appreciate this presentation, all three, Neva and Kara and Maria. So thank you so much. I work with Vitality Review. I'm in the fetal and infant mortality review program. So we support, the multidisciplinary teams that are looking at, of course, the worst outcomes, when moms who have contracted COVID during pregnancy have a pregnancy loss, either a stillbirth or an infant death. And I'm wondering if there is any surveillance going on at CDC around deaths that are indirectly attributed to the pandemic. So we're gathering data not just on, the mom had the virus or the baby got the virus, because those are pretty rare, but if disruptions in care and services played a role. So just an example, a mom didn't get in for prenatal care early or often because of lockdowns and lack of availability of services, and then perhaps her exacerbating hypertension went unnoticed. So what kind of data are you collecting around indirectly attributable deaths to COVID? Or maybe you're not, just wondering.
I can get started and then pass it over to my colleagues. I don't know if it's necessarily framed as, maybe non-direct or attributable deaths to COVID, but there are several surveillance systems that are being leveraged for different analyses, including PRAMs, looking at those disruptions in care and seeing how that may have changed as policies changed around COVID, and looking at adoption of virtual only versus hybrid types of prenatal care visits. I know that's an analysis that's ongoing, but there are several different analyses that are leveraging PRAMs. There's also been more cross-sectional analyses looking at doc styles and other types of cross-sectional surveys that are giving us data on maybe changes at the clinic level, clinical changes that may have some impact on maybe those indirect outcomes that you mentioned. There are different electronic databases as well. The Premier database is looking, there's lots of analyses looking at cross sections between those comorbid conditions that may be contributing to those negative outcomes that we're seeing in a disproportionate way. So there are different data systems that are being leveraged with this in mind, and looking at those different outcomes that aren't just necessarily related to the traditional kind of definitions of what we're seeing as severe illness, which ICU admission, hospitalization. So there are different ways that people are looking at the impact across the COVID-19 response, especially the scientists and subject matter experts that are on the pregnancy and infant linked outcomes team. I don't know if my colleagues have others to add.
No, I don't have, I was going to reference PRAMs as well as the most familiar analyses I know that are happening. I'm not sure if it's in relation to maternal mortality, but definitely those sort of indirect consequences, if you will, of COVID are being assessed. So we can ask around as well and follow up. That would be helpful.
Thank you, that's super helpful. And I'd love to see the PRAM supplement that you referenced, Rachel, from New Mexico. Is it available on your website?
I don't think we have it on our website, but I could connect with you over email, Rosemary.
Thank you so much.
Any other questions, thoughts, feelings, reflections that you all would like to share? We have about 4 minutes left in this session. I'll also remind everyone that you'll have access to this presentation and the associated resources for up to a year from today. So you all will have those things. And to our presenters, if you want to add any of the links that you've shared in the chat to the platform so that folks can have access to them, you can do that as well. All right, I'll hold space for any questions that come in, but I do want to remind everyone that we have a wonderful plenary session immediately following this session. We'll get a small 20-minute break. And then we have our plenary session sharing our why, where you'll get to hear from your colleagues in Virginia, California, Tennessee, Ohio, Colorado, and more places. So, and then after that plenary, there'll be another round of workshops later in the evening for folks who are on a different time zone than us over here on the East Coast, or who would just like to continue to engage. All righty, it looks like there aren't any other questions. So thank you all for joining, and we'll see you at the plenary. Thanks so much to our presenters.